I think we're live. Dovydas, thank you so much for being here this morning.
Yeah, thank you for having me.
Yeah, could you tell the audience about the vision and mission of your company?
Yes, so our company has been founded just last year. So it was February 2019. Ligences is founded by medics and medics only. And our mission is to make medicine as accessible as possible with the help of AI. So our current project is heart ultrasound imaging examination, and we are automating it. The problem with this method is that it has a lot of manual work involved, and we want to take away all that burden from medical doctors and leave them with only analytical work. So that's our main goal.
Yeah, I mean, you guys are working on cardiovascular diseases, right?
Yes, that's right.
And cardiovascular diseases as a whole, or one specific use case?
Perhaps as a whole, because the heart ultrasound imaging is to some extent a first choice method for diagnosing cardiovascular diseases. So it's like a entry further to a healthcare system. So first of all, you get your echo done by a physician, and then they know what is wrong with your heart.
Is any publicly known data about cardiovascular disease and the number of deaths as a percentage and the cost of it to a specific healthcare system? I mean, are there any publicly known stats about this?
Yeah, there's a lot of data on that. And the last time I checked, so in European Union alone, we have over 6 million cases each year of cardiovascular diseases. And that costs our economy about 210 billion euros each year. So I remember that back in med school, they taught us that people are always afraid of cancer.
Yeah.
However, they die from cardiovascular diseases, nevertheless.
Wow. I mean, from my understanding, this is a disease. Cardiovascular diseases are on the rise now. Is there any general reason as to why the death rate why the death rate is kind of increasing?
The reasons are quite vague, and they have been known for a while now. So everyone knows what causes cardiovascular diseases. So it's basically that Western lifestyle, so a sedentary lifestyle, having lots of sugar, eating lots of calories, not moving enough, eating lots of fats, and that's it.
So I mean, yeah. So like you mentioned, with your technology, what you guys are doing is looking to augment the cardiologist, maybe, and kind of bring some automation to that process. Now, what does the current pathway look like when assessing a cardiovascular disease, and what's wrong with it, and what could be better with the current system, and how is your product facilitating that?
Yeah, so the process may differ in some countries. However, generally, the first thing you see when you feel something wrong is with your health. You go to a GP or your family doctor, and they usually put a stethoscope on your chest to listen to your heart. And if they suspect if something is wrong, they will refer you to a cardiologist. So in this case, a GP or a family doctor, they serve as a gatekeeper to a healthcare system. They prevent you from stepping your foot into the healthcare system because it's expensive. And after you go to your cardiologist, they will usually just consult you on what is wrong, and if they're not sure, they will most probably carry out an echocardiography study. So they will check your heart with ultrasound waves, the way it moves, the way it functions. And in my opinion, what could be better in this case is that more functions would be assigned to a GP or a family doctor. So for example, a heart ultrasound examination could be done in the first base, so by a GP or a family doctor. Oh, wow. And for example, our tool could give some preliminary results for a GP or for a family doctor. And if he or she is not sure about your condition or whatever is happening with you, they could then just refer the results they got from the echo and what the AI has suggested them to a specialist, to a cardiologist.
That's really interesting. So, so you don't really. I mean, hopefully, when your technology is out and working, you wouldn't need a cardiologist to kind of assess the patient. The patient can be assessed by the GP using your technology, and then the results can be relayed to a hospital if further action needs to be made. Right?
Yeah, yeah, to some extent, that's right.
Yeah. In terms of what you've built so far, obviously we spoke prior to the interview, and there were a few components that surprised me, I must say. Could you tell us what you've built, and how you're currently assisting hospitals right now, and in what capacity right now?
Yeah, so maybe just first of all, I'll talk about the examination, the heart ultrasound imaging we're solving. So basically, right now, there's a very huge waiting line, especially in European Union. So patients, on average, they wait for 5 weeks to get admitted to a hospital to get this examination. And the greatest reason behind this is that there's a very huge, very extensive protocol that must be carried when performing this examination. And usually, a physician would spend around 30 to 90 minutes when performing the heart ultrasound exam. There's a lot of manual work involved as well. So on average, they make around 250 clicks on a keyboard of an ultrasound machine as soon as they're finished. So our solution is basically a deep learning algorithms. And what they do, they simply replicate the steps that are normally done by a cardiologist during a regular heart ultrasound examination. So basically, it detects the image view of a heart, and then it knows what measurements must be done. So basically, we're subtracting the manual work from medical doctors. So from now on, they don't have to make all of these measurements themselves. They're done automatically. And if medical doctors are not okay with what AI has done for them, they can always alterate the annotations, the measurements done by the AI. So our value proposition is that we allow to make the echocardiography a much faster procedure and more accessible. So instead of doing it for 30 minutes, you can manage it in 5 minutes.
That's amazing. And I mean, you mentioned that you guys are, along with your product development, you're also doing trials. I mean, could you highlight in what capacity and who with?
Yeah, the trials themselves is not at a very large scale right now, but we have around 600 patients involved. So there are several clinical centers located in different countries. So several of them are in Lithuania, one is in Latvia, and another one is in the Netherlands. So we're getting the patient data where we validate our solution on. As I've mentioned before, we talked, before we went live. So yeah, we have a first use case in Australia. We just started the integration process, and it's not at a very large scale right now, but it's expanding. So we hope to get the best results out of it.
Yeah, I can imagine. In terms of your technology and the algorithm, does it have flexibility to? I mean, obviously, you're right at the beginning of your journey, trying to diagnose cardiovascular diseases. Do you think eventually your technology would have a different use case? Eventually.
Perhaps. So first of all, we're marketing our solution to be used in a post-processing. It means that whenever an echocardiography is done, you then just check the results on your computer later, so after the procedure has been done. However, we're exploring the opportunity to install our solution right into the heart ultrasound, right into ultrasound machines themselves, so everything could be done in real time.
Wow. And is that something that you guys are working on now?
Not specifically, but yeah, we're just looking for ultrasound manufacturers who would be interested in adopting such a novelty inside their ultrasound machines.
That's really interesting. And I mean, what was the initial ideation process like? And what's kind of the story behind around the co-founding the company like this? I mean, I understand that you're the CFO. You've got a couple of more. You've got a couple other co-founders. I mean, could you kind of highlight your story?
Yes. So First of all, two of our original founders, they're both medical doctors. However, they come from different specialties. One of them is a cardiologist, and the other one had a lot of expertise, quite a lot of experience in deep learning projects. And so one evening they sat down, they were just chatting, and one of them told another that it would be cool to have an automated system that could do all of the measurements instead of having to do them myself. And well, they discussed and they found out it's actually feasible to make a system like that. And they checked online. There were not a lot of solutions on the market back then, and so that's how they started. So that's how they initiated the whole company. How they initiated, the gathering of the core team. Currently have 4 co-founders working in our team.
That's amazing. I mean, what types of regulatory barriers are you guys facing, and how are you guys planning to overcome them? I understand that you're not just working in Lithuania, you're working across the world. I mean, you also, before we went live, you also mentioned in some capacity working with a hospital in Australia. I mean, what types of regulatory barriers are you guys facing, and in your local jurisdiction and also globally? How do you guys have to kind of account for that?
Yeah, so you can use your AI pretty much anywhere if it's not meant to sell. However, if you want to sell your solution, your piece of software, then it must be regulated and have some regulatory approval. So in European Union, we have a CE mark, and there's now actually a new regulation called the Medical Device Regulation, and it's abbreviated MDR. So we're pursuing. So we're currently running this process. It's quite an extensive one, so it requires a lot of dedication from our team members. So we have like 3 people working on that. I actually myself, I have to work on that as well. And we plan to have our CE mark next year in second quarter, so around April or May.
That's amazing. I mean, have you guys got any throughout this short journey, from co-founding the company? I mean, have you guys acquired any grants, along the way? And I mean, could you kind of highlight some of the partnerships and the people that you're working with?
Yeah, actually, the pandemic itself has been quite, valuable to us. So there has been a lot of, need for some automated products, and there was a lot of cash involved when offering companies, to come up with solutions against COVID-19. So we actually got one grant from Lithuanian government to help create a system, a prototype that can help fight against COVID-19. So actually what we saw, when the pandemic started, nobody knew anything about the novel disease itself. It was, a mystery. But then we started to get more and more information about it. So how it actually, affects our immune system, how it actually affects our bodies. And we saw that there's a lot of patients who are positive for COVID-19. They also have, some sort of a secondary disease on top of that. And it actually made sense. We actually saw that at least 30% of all of these patients, they have some underlying cardiovascular pathology. And there were, 2 things to think about. So first of all, the first meta choice right here was the echocardiography. So all of these patients will get one echo done for differential diagnosis to check what's wrong with them. And also medical doctors, they must be protected by any means. So we must limit their time of exposure to potential infections. So this is when the solutions like ours, they come, in handy. They are valuable because we allow medical doctors to spend less time doing the examination itself, so they can, they're protected from the potential exposure.
That's really interesting. I mean, in your opinion, in like an uber optimistic world where you have the funding and the resources you need, what do you think you could achieve from a product and a company standpoint in say 24 months?
Yeah, that was a very interesting question. Quite hard to imagine, but I thought that yeah, if I had the resources, I would hire a lot of medical doctors, a lot of deep learning specialists to have that company of great minds who can cooperate together and build very interesting products in healthcare systems. So what is good about medical doctors, they actually know the pain points inside the healthcare system and they know how to tackle them. And the expertise in deep learning, it can help create some sort of software that could actually benefit the healthcare system. And I believe that many boring tasks in healthcare can be automated using AI. So we would leave more time for medical doctors to spend with their patients, actually, to keep communicating, because you cannot avoid it, human contact. I think it's one of the most important things currently in modern medicine.
And I mean, you mentioned prior. I mean, are you guys looking to raise venture capital? And like, I mean, as we approach the end of the interview, I mean, is there anything you kind of like to highlight?
Right. So currently we're good to go. I've mentioned before that we have recently secured our pre-seed funding rounds. Yeah, it was quite interesting because we managed to do this in the times of the pandemic itself. So quite, unfortunate circumstances, but we managed it somehow. So for a year and a half, we're good to go, but we're looking forward to raising a VC in a year or so.
In terms of raising your pre-seed round, so to speak, I mean, did you have to? Was the process slightly different? I mean, obviously things probably had to be done virtually. I mean, how was it raising that round?
So first of all, it was first time in my life I had to raise an amount of money from people I don't know, and it was a good experience. The process itself, it was quite long. So we start our journey back in 2019 December, so just before on the verge of 2020, and yeah, we had all of our signatures in March, so right at the time when the pandemic has started, and yeah, we had several of our meetings already and remotely online, but well, we actually had a very strong business plan, and we somehow managed to persuade our investors that it's a good cause and it could benefit everyone in the near future.
Yeah, amazing. Are you guys hiring or?
Yes, we're actually hiring.
Yeah.
So I could use the opportunity to tell people out there who are listening. Yeah, we're hiring deep learning engineers. So there's one position currently available. So you'll have an opportunity to work in a beautiful old town of Vilnius. So if you're listening, I think you'll have my contact somewhere, and hit me up.
Yeah, amazing. I really appreciate you jumping on this morning. Thank you so much.
Yeah, thank you for having me.
Take care. Bye.
Bye-bye.